Aloha, my name's Anna Covert, and I'm coming to you from my battleship here on the beautiful island of Oahu. This week on the Covert Code, the topic is the evolution of healthcare in marketing. My special guest is David Sanchez, CEO and founder of Digitalis Marketing, Digitalis Medical and Miracle Recovery, an RN nurse with over 16 years of experience in healthcare is coming to us with a unique perspective on how he has taken that expertise and leveraged it into digital advertising. So excited to have you on the show today to talk about some of your strategies in AI, I think some optimization, keywords, and we'll just have a little geek fest together.
Hey, that sounds great.
Wonderful. So to get us started, can you tell us a little bit about, I know it's such an interesting story you have coming from this background as an ER nurse, and how did you get into digital advertising? What's the story?
It's been quite the long journey, but I became a nurse in 2009 and was working in the emergency department, and there's just so many things going on there. That's really when heroin and bath salts and spice really started hitting the scene. So we were seeing overdoses every day, people dying, people asking for help. And I really felt like I needed to do something to make more of a difference. So I'm a Christian, and I went and talked to my pastor and said, I feel like I need to do something to make a greater difference. And he said, well, whatever you want to do, just, put a plan together and come talk to me, and we'll see what we can do for the church to come behind and help support it and make it happen. So lo and behold, a couple years later, after a bunch of research, I started an addiction treatment program and started saving lives. But in the middle of that, through the process, I discovered that addiction treatment or the rehab industry is extremely competitive. I had no idea. It's my first business. I didn't know anything about marketing or advertising. And I found out, before long, I was paying $10,000, $15,000 a month just for Google ads, Facebook ads, and it was just so expensive, over $100 a click. And this was over 10 years ago.
Oh my God.
It's just very, very competitive, very expensive. And I said, I've got to start learning this stuff because people don't know we exist unless we're online, unless they can see us.
Right.
And I had no clue beforehand. So then I started getting a team together, and this was a videographer, a social media manager, someone doing business development on the ground. And I was starting to learn search engine optimization and Google ads, Facebook ads, video advertising, all these different things. But I was working with an agency, and it was just really frustrating. Our performance kept going down. Somebody had hacked our Google business profile,
Sure.
and things just weren't improving. There was no transparency. I didn't know what was going on. So I talked to the guy, and I said, hey, you're doing our SEO. I just don't see things improving or getting better. And yet they had no answers for me. There were no numbers I could look at to see the impact of their work. And then one time the guy even showed up totally high on heroin to the meeting.
No.
Oh my gosh. Okay. That's the final straw. This is not going to work.
Did
And so
you do sell him rehab? You'd be like,
I tried. He couldn't stay awake on the call. So that just did not work out very well. So I talked to the guy that did the sales call with me initially with his agency. And I said, so can I get a different guy to work with, or can I talk to his manager or something? He's like, no, we don't really have a process for that. Yeah, there's nobody else you can talk to. Okay. I was like, okay, this is done. No more. No more. I gotta just buckle down and learn this myself, because I could go try to hire another company, but I'd already started learning a lot of it. So I said, you know what? Let's just do a better job ourselves. And then within a year or two after that, I said, you know what? We've been doing a great job. We've seen such better results. Why not just provide this service for other people too, to offset our own costs of our marketing staff? And so that became Digitalis, where we're a marketing agency that specializes in healthcare, bringing new patients, especially to behavioral health facilities, hospitals, specialty care clinics. But that's the story.
wow, that's really interesting. So,
Yeah.
being, a digital marketing expert myself, one thing that I wanted to ask your opinion on here is what we've found with some different types of medical marketing, there can be a
Mm,
very vigorous process to get Google approval, right? For example, with I know you
that's for
do
sure.
behavioral health, but Botox or anything really. I mean, we did COVID. I used to do an urgent care, sorry, urgent care in
Yeah.
Maui, and then over COVID, we had to get special, authority to be a COVID center. What is your experience with this kind of registrations and because we found it to be very frustrating. I'm sure you had too with
Yeah.
getting things approved.
Yeah. The thing is, there's no cookie cutter, and you could be familiar with the process no matter which specialty it is, but it's still a new experience every time, pretty much in my experience, because you don't know if they're just going to accept what you apply for, or you might just be able to create a Google Ads campaign and they just let it fly just like that, or they might completely ban everything, suspend the account, or somewhere in the middle, you have somebody where you're submitting things, you send them proof documents, you send them licenses and all these different things, and it's just a couple steps. So you really don't know until you do it. That's been my experience anyway.
Interesting. So, what have you seen in regard to, one of the things I'm very passionate about is fraud prevention.
Mhm.
And that's one of the things I wrote about in my book that was published last year, and why I wrote it because of what the same thing that you're experiencing. I've went the other side of that. That I was working with all different types of clients, and I had people crying to me on the phone. Where had I been? And they had been through so many agencies
Oh
and
no.
taken advantage of, frankly.
Yeah.
And so
It's
I,
too
I
often.
went to Forbes and expedited my book, and because I felt like it was a crisis, so, and we're still under this crisis. But from my perspective, I mean, the fraud's just getting worse. What
Yeah.
have you seen in terms of what tools are you using to prevent fraud, and what are you seeing in the healthcare market?
Yeah. I think the biggest one that I use right now is called ClickCease, and that does a
My
really
favorite.
good job. Yeah, you use them?
Yes.
Yeah, yeah, it works really well because it eliminates so much of the spam, and there is a ton of abuse in the advertising field. It's sickening sometimes because you know that there's a huge percentage of agencies that are either spammers or fraudsters that are just complete not even doing what they say they provide. But then there's another large percentage of people who are trying, but they're kind of learning as they're going without actually having a repeatable system or process, so they don't really know if they're going to get results for the client. And so obviously for you and I, what we want to do is be excellent and be very consistent. And we have time tested, battle tested um, techniques and systems that we use that work over and over again. So that's where we want to be, is at the top.
Yeah, yeah, and it's I think it's really you're 100% right because even today, some of the top companies and they're huge companies and they're saying that they're battling fraud and they have human and these things, and what we've come to find out is that that's not the case. That they're in the programmatic fraud, and it's up to 60% now.
Ooh, man,
No, and so
that is massive.
it's really, really scary, and I think one of my biggest fears is invalid traffic and how it changes. Because right now it's easy for us to detect, and it's shocking how much you can hook your click cease in and
Yep.
start seeing the savings, but that's only in search. This does not apply to any of the, partners or display ads for everyone who's listening. And I just wonder about, now the bots are getting so sophisticated, like, what is still squeezing through?
Yeah. Yeah. We never really do know for sure. I do like detecting by IP address or by country to limit that. Like, let's say it's a local client and they only want local traffic. We can limit that through ClickCease, which I like that, by location. You can also do it on the server end. I have done that before, just depending on how bad the issue is, because we also build a lot of client websites. Typically, that's where we see the best results, when we're the ones building it. So
Absolutely.
by default, we end up doing that.
So what other techniques are you using? I went to your website and I saw you have some pretty big promises here. So
Yeah.
how are you automating these outreach efforts for people?
First of all, we start with strategy. So there's so many different things you can do. I mean, you and I that have been anybody who's been in advertising or marketing for 10 years or more, there are things that come and go. There are things that are popular, but you know that it all starts with strategy. So the way I try to look at it is first principles. What is the straightest line to get the client their results? So what do they really want? And sometimes they don't need search engine optimization. Sometimes they don't need content. Sometimes the fastest path would just be Facebook ads or Google ads. But I like to start with a comprehensive approach to say, what's the goal? what are the barriers? Where's the friction in between where you want to be? And then just create a strategy around that. I usually create a custom plan to design, really what they need that's going to give them the straightest path.
Wow. And so it's interesting your idea there of, who wouldn't need a website or good content to fulfill that ad? Are you just talking about, do you do ads that are inside of Facebook or like a Facebook form that would bypass the need for the customer to go to the website? Is that when you would not recommend content?
Yeah. Yep. Yeah. If it's a type of client where people don't need a ton of education, in that situation, I wouldn't recommend a lot of content because if it's something that doesn't require um, a ton of trust to be built up. Like let's say it's lower ticket service and they don't need a ton of information. That would be the type of client that they just need to know who you are, how you can help
Urgent
them,
care, maybe.
see a face. Yeah, like that because people know what urgent care is. They don't need to be educated on it.
Right. There's one
If
closest one to them. So,
Exactly, yeah, if it's relevant to them, yeah,
right. Yeah.
and they know that it's gonna take their insurance or that what the cost is, or
Right.
the fact that they have openings right now and it's a 10-minute wait, then yeah, just do advertising and they'll come.
So what other, new things are you excited about, or what trends are you seeing in healthcare marketing?
Yeah, a couple of big trends, and these have never not been there, but they're becoming more and more relevant over time. It's becoming more obvious. So I would say brands, first of all, brand-based marketing has never gone away, and that's really what Google's algorithm was designed to promote. It If you build a brand, then you're going to be more visible because you're everywhere at once, and regardless of whether you're, people looking you up on ChatGPT. I had a new client come to me, find me on Grok last month, which is the first time I'd seen that. Yeah, but that's because I had done my brand building well. I did it correctly. I'm in a lot of different places online, and so they found me through that. Even though obviously I'm not doing something to optimize for Grok, I'm optimizing for everything, and that's how they found me. So building a brand is really important. You want to be everywhere as much as possible and on as many different channels as possible. So that's number one. The other one I would say would be uh, publicity. So digital PR is something that we've really stepped into this year in particular because it's so massive the reach that you can have when you focus on PR. So that could be,
Are you
news
using
stories.
EIN Newswire, or are you using what distribution venue are you using for that PR?
I'm mainly focusing on reaching out to reporters directly.
Oh, good for you.
Yeah. Yeah. Doing that and then podcasting has been the way that I've seen to have the biggest bang for your buck, the biggest impact for your time, really.
Interesting.
Yeah.
Um, hmm. So, what are your thoughts? You brought it up. So this is the movement towards zero click. And since we're both, Google Ads nerds, we'll call it. And I love being a nerd. So I think it's a
Me
statement of
too.
admiration,
A
but
mark of distinction.
it's a market distinction. Thank you.
There we
Yes.
go.
But really now with what's happening with zero click, like the motion towards zero click. And for all of the listeners, what that means is when you search for something, a solution before, Google would just deliver, or any browser that you're on, deliver results to you in a
Yep.
and you had to kind of do your detective work. You had to search, you had to click. Now what's happening is it's Gemini is summarizing at the top a response for you. And those are curated from online. And you can see the source is this little paperclip, like a little, there's a paperclip icon next to it. And but what is that going to do to advertising? Well, now if all the ads are pushed down to the bottom, I mean, pretty soon we'll probably see. I mean, my hypothesis is that they're going to start charging for browsers with or without ads, and then next to it would be ads. I don't know. What do you think's going to happen?
I don't know. That's a good question.
Yeah.
Well, the thing is, Google's constantly optimizing for the user experience, and that's why we're seeing that because people want the results right now. They want to see the results, but Google gets 80 to 85% of their revenue from ads.
Right.
So the ads are not going anywhere. They'll figure out a way to get their ad revenue.
Yeah.
So if you're willing to pay to be seen by people, they're going to get you in front of people that are searching.
Because then the scary part is I have a lot of clients who are like, oh, we need to get into the results, and that's an SEO strategy, right? But then I think it'll become the real future here is what people can what AI people trust and decide to trust, and then that's the
See
experience.
that?
Will people still go to Google if they think that Google is curating responses based off ads?
Yeah, so that's where it depends on the user experience. If
Right.
people are getting what they want from Google, as far as, getting the good results that they can trust, then they're going to keep using it, I think.
And then how do we determine that? What analytics will we be looking for to say that is a good experience?
Well,
Are you
yeah.
the same conversion?
Well, we know as marketers, we
Totally. I
see.
mean, here's the thing: if we don't, no one clicks on anything, if it's delivered by zero click, and there's no click
Uh-huh.
before they get the knowledge, and now some people might click in the paperclip or not, right? So it's gonna be interesting. I think it's one of the reasons why search has changed and why the frauds has peaked or is continuing to go up. Is because now results are going down. When I say results, I mean these advertisers' bottom lines are
Yeah.
shrinking
Yeah,
because
true.
they're changing it. They're changing the way search is happening. People aren't going to Google. They're going to the Chat GTP and others to get answers, and that's changing a lot of traffic. And so they're going after, hardworking companies to get more clicks.
Yeah, that's true. But at the same time, the more your brand is in different places, the more likely you are to show up in that zero search result. So I think really that's where it's at. It's the end.
But what tools are you using? You mentioned about you're doing some keyword planning for clients. What SEO tools do you recommend and what you're using to be the source of truth? Because I've also seen that can be really interesting where SpyFu and DB and all these other third parties, they all have different results, right?
True.
Brands, of course, trying to sell you something, but what are you using?
Yeah, I've got three main ones I've got a new one that I started using recently too. So yeah, there's quite a few. I'll say that. But for local SEO, I would say for the highest visibility, if you're using WordPress, I'd highly recommend Rank Math because their schema tool is very, very good. And you can actually migrate over from Yoast with like one or two clicks.
Wow.
So I highly recommend that. That's what I recommend for all my clients. Um, just because the tools that are inside of it, you can use. It's like got 10 tools in one. It has a 404 error detection
Oh,
thing. It's got a 301 redirect tool built inside of it, so you can probably get rid of several tools. And the nice thing that I like about it, another thing, is that it's not heavy on the code, whereas Yoast really does slow your website down. So I
yes.
would recommend that. And what I've seen with clients when we switch from Yoast to Rank Math is they see a big difference with showing up on tools like ChatGPT and Gemini because the schema is really high quality there. And you can pay for a pro version that gives you more different types of schema, but the automated one that I found on the free version is actually very, very good by itself.
I'm like
I
ready to
definitely recommend that.
that's
That's
a
one of the top ones.
yeah, thank you so much for that.
Yeah, absolutely.
I
And
found that Yoast is clunky. It feels clunky and when you want to update it, it is. You have to go into every single post and update the schema, the social schema, especially if you've so this is and we've had all those things you mentioned have been pain points at some time for us internally.
yeah, it was worth it. I decided to jump onto it a couple years back, and I definitely haven't like learned turned back because it's definitely been a great tool. I haven't had any complaints with it.
Excellent. Well, we're gonna try that out.
Yeah, yeah. And then a couple other ones that I would recommend. Hrefs is a classic, but it's still working really, really well. I use mainly that for keyword research when you're looking at organic. It's not the best for local keyword research, for local specific. So to supplement that, I do use KW Finder because I find that the quality of the suggestions, even if you're looking at a specific category, if you don't know what people are searching for in a certain county, city, zip code, state, whatever, it's it's just very intelligent. I don't know how their algorithm does it, but it gives you great recommendations.
Wow, good to know.
Yeah. They're actually um, better than Ahrefs because Ahrefs is specific by that keyword. That's the exact keyword you type in.
Hmm. And what do you think about, healthcare today? Is there any concerns, just to switch it a little bit, with what's happening with policy and legislation? Are you seeing any concerns with how that might impact consumers, I guess, with Medicare or other types of changes that, we might see?
Can you be a little more specific?
Like with now, like with some of the, for example, I work with a local medical company here and now with Medicaid maybe not being, them cutting Medicaid and Medicare or is it Medicaid? I always get confused which one with
Might
which.
be both.
Might be both. With the administration is, and you do a lot of healthcare, are people concerned? Are you seeing that there's a demand shift? Are you changing any of your advertising because of that?
I haven't seen any changes yet. I think right now it's mainly fears, is but I don't know. I mean, it could change from state to state, I suppose, but I don't know if legislation or any administration changes have actually impacted it yet. I'm not that knowledgeable about it. I
Is
mean,
there
it's a concern for everybody, to be honest, because our system obviously has issues. We live in the greatest country in the world, but at the same time, our system does have issues. I think healthcare is still way too expensive, but for people that don't have state finance healthcare, but I'm not sure. I guess time will tell.
Yeah. Is there anything else, with regard to compliance or different types of things that might be changing that you want to discuss on how you're advising companies to market safely or hold data or anything like that?
Yeah, I mean, the biggest thing is to find people that have the knowledge to be able to help you. There's quite a few solutions out there. Um, I use one called Termageddon to help with terms and conditions and privacy policies that automates it really well. I do recommend them. It's like $10 a month per site. No, I think it's like $4 a month per site. So it's very affordable, but they automate your privacy policy page, your terms and conditions. So I do support them because that's been a lifesaver for me. Yeah, basically one of the co-founders is a intellectual property lawyer, and so
Well,
they're way on top of all the legalese stuff.
I like the name.
Yeah, yeah, that's funny. It's a good one.
It is a good one. Excellent. Well, so I guess to switch it up here, where do you see yourself in the next 5 years?
Hmm. I don't know. I'm not sure. Maybe doing the same thing I'm doing right now. I mean, I love doing digital marketing, and I love the fact that I could do that and help healthcare facilities help more people. But at the same time, I have like I mentioned, I do still have a recovery program where I'm helping men recover from addiction. It's a Christian-based program. It's faith-based here where I live in Northern Arizona, and I love being able to do Bible studies in the morning with the guys, teach them how to create a resume, and help them to recover and grow and learn how to be successful in life. So I love doing both of those things and then hanging out with my family. So as long as I could keep doing those, I'll be happy.
So are you still a nurse at sometimes, or you've completely you're not no longer an ER nurse in any capacity?
I'm not working clinically. Technically, I would be considered a nurse executive because I'm running my recovery program, but I'm not working. I'm not starting IVs in people's necks anymore.
Okay.
No, nothing like that.
Well, that's very exciting. Congratulations on your successes. It's very admirable to work in what you're working in. So I
Yeah,
appreciate it.
it's fun to make a difference. That's really what I enjoy. I became a nurse because I wanted to help people, and there's definitely lots of ways you can help people. So I think that's really what marketing's about too.
It is. It definitely is. Well, thanks so much for being a guest today. Let's see if people want to get a hold of you, they can go to what is your domain?
Digitalismedical.com is our website. If you're interested in learning more about healthcare marketing and see if maybe we're a good fit, you want to talk, that'd be great. You can schedule a call with me through there or on my LinkedIn if you want to just chat. If you want to talk, I'd be happy to talk. David Sanchez RN is my link there on LinkedIn. So I'm always available.
Great. Well, thanks so much for being here. And to all my guests, please join me next week as I interview another industry expert and topics to help you succeed on and offline. I'll see you in the pixels. Aloha. I hope you enjoyed this episode of the Covert Code podcast. To stay up to date with all our future episodes, follow us on your favorite podcast platform. Your support means everything to us. Please take a moment to leave a review and share our content with your friends and colleagues on social media. Your feedback helps us improve and reach more digital innovators like yourself. See you in the pixels. Aloha.